Here we have the definition of a gravid uterus, which is a woman's uterus in a gestational period. And we have a question: why the residual volume of a stomach is high in pregnancy but the pulmonary residual volume is low? The answer is that the residual volume of stomach is high due to hormonal and mechanical factors. The first factor is the hormonal factor, which is progesterone, causes relaxation of the smooth muscle in the stomach and lead to delayed gastric emptying and high residual volume. Enlarging, on the other hand, we have the mechanical factor, which is enlarging uterus, compresses the stomach and slower gastric emptying. And we have the high residual volume, which causes heartburn and reflexes, both common in pregnancy. And here we have the decreased pressure of lower esophageal sphincter by the effect of progesterone. In contrast, the pulmonary residual volume is low during pregnancy due to mechanical and physiological adaptations. Here we have the mechanical factor, which represent the expanding uterus, pushes the diaphragm upward, reducing the lung volume, such as the functional residual capacity and residual volume. And however, to compensate, thoracic dimension changes, which can cause high rib cage diameter to maintain total lung capacity. Hormonal influences also cause relaxation of airway smooth muscle, decrease airway resistance, and improving lung compliance. To sum up briefly, pulmonary changes: low functional residual capacity, high rib cage diameter, relaxation of airway smooth muscle, low airway resistance, low residual lung volume, and high respiratory capacity to meet oxygen demand during pregnancy. And here we have MCQ: which of the following is correct regarding cardiovascular changes in pregnancy? So here you can see the options. Option A: systolic and diastolic both decline early in first trimester, then rise gradually toward term but won't back to pre-pregnancy state. B: both decline early in first trimester, then rise gradually toward term, eventually back to pre-pregnancy state. C: both rise early in first trimester and reach nadir by 24-28 weeks, then decline toward term, eventually won't back to pre-pregnancy state. D: both rise in first trimester and reach nadir by 24-28 weeks, then decline toward term, eventually back to pre-pregnancy state. Lastly, both decline from first trimester toward term, but won't back to pre-pregnancy state eventually. So the answer is A. And here the second question is: which of the following is most accurate? The first option: hormonal influences, in bracket progesterone, causes relaxation of a smooth muscle and increase airway resistance. Wrong. B: low tidal volume produces respiratory alkalosis. C: tidal volume is the volume of air trapped in the lung after deepest expiration. Wrong. D: tidal volume is the product of respiratory rate and minute ventilation. Lastly, E: both the respiratory rate, pulmonary changes, and in bracket and venous blood pressure, cardiovascular changes in bracket values are unchanged. So the correct answer is E. And here we have the third question: which of the following cannot be seen in blood gases? Of course, we cannot see metabolic acidosis. And the fourth question is: which of the following is correct regarding pulmonary changes in pregnancy? So the correct answer is A. Tidal volume increases, minute ventilation increases, residual volume decreases. Blood gases cause respiratory alkalosis and alkalotic urine with high pH, low pressure of the carbon dioxide. So the answer is A. And here we have the fifth question. I think, yes, these are the last two questions. So the fifth question: which of the following values is unchanged regarding hematologic changes in pregnancy? The answer is platelet count. which of the following, the last one, the sixth question, which of the following is most accurate regarding cardiac output and murmurs? The correct answer is A, cardiac output, lowest in supine position and highest in left sternal position. Thank you so much.